Hello and welcome. I'm Dr. Raj, an anesthesia doctor practicing in the USA. This is our live Q&A session where we bring well-renowned doctors from around the world to your home to answer questions to ease your worries. If you're here for the first time or still not subscribed, I encourage you to subscribe and hit the bell icon so you can receive an update when a new video is released. We try to bring experts every weekend. Like most of you, I have young children and I'm worried about their health and have so many questions related to COVID. If you have any questions, type in the comment section. I will try to get to as many as I can. Do check for other COVID related videos in the description below. Here is a quick disclaimer, and you can also find this in the description below. Today we are fortunate to have three child health experts or pediatricians of special expertise in pediatric ICU. First we have Dr. Lakshmi, who is a neonatal or newborn ICU doctor and practices in the USA. Welcome, Dr. Lakshmi.
Thank you, Dr. Raj. I'm really happy to
Next
be
we
here.
have Dr. Rakshay Shetty from Bangalore, India. Welcome, Dr. Rakshay. He is a child ICU specialist. He heads one of the biggest child ICU centers in India at Rainbow Children's Hospital, Bangalore. He was trained in some of the best centers in India and Canada, like PGI in Chandigarh and Sick Kids in Canada. He has keen interest in family-centered care and focus on improving patient care. He has been very active in providing care for both sick adult and children with severe COVID and carries a very rich experience in managing sick COVID patients that he's going to share with us today. Finally, we have Dr. Vijay, a pediatric ICU expert who practices in the USA. So welcome, Vijay. Without further ado, let's get to questions. I want to remind you to type any questions you have in the comment section below. All right. So, Rakshay, India is going through a second wave. What you have seen with COVID in children? Were more children admitted to hospital and ICU?
Yes. So thank you, Raj, for this wonderful webinar session. So again, welcome all of the participants in India and abroad to attend this session. So the session we planned essentially to address the common concerns with regards to COVID in children and essentially aimed at the public. And it's a wonderful session because we have experts also joining us from one of the best hospitals in the United States, Dr. Vijay and Dr. Lakshmi, to share their views too about the US experience. Now, this question was by Raj was, did children get really badly affected in second wave? So the second wave was quite different for us. It's that what we saw compared to the first wave was a highly contagious COVID virus. In the first wave, we noticed a lot of people with issues, morbidities like having a high blood pressure, high blood sugar values. Those are the ones who got affected with COVID. This time around, we saw a lot of young people, 20 to 40-year-old. Many of them did have diabetes, hypertension, obesity, but some of them did not have any comorbidities. They came with extreme level of sickness, very bad lungs. I mean, in fact, to look at the X-ray and the scans was really terrifying. Many of them came with a very low oxygen levels, in 40% and 60%. And me, despite being a child specialist, landed up managing a lot of adults because there's a significant scarcity of blood of beds around to manage a lot of people who are becoming sick at one time. What, however, was remarkable to note that even in this wave, the disease was not that severe compared to what we saw with adults. The number of children who got infected was more because this time around the virus was far more contagious. So many more people got infected. In fact, in the first wave, it was quite common for us to see one of the family attendant becoming unwell and the rest isolated and didn't contract infection. But this time around, the entire family got infected very easily, despite them saying that they isolated themselves as soon as the diagnosis happened. So it was quite contagious, and no wonder the number of portion what we saw of children getting infected, the number was 3 times higher what we saw compared to our first wave. But did the children become sick? No, I don't think they became sick compared to what we saw in the first wave. For most part, it was a mild illness. For most part, they had fever for a few days. Some children had loose motions, and some very occasional ones did develop pneumonia. But majority of this pneumonia were less severe, was far more easier to manage compared to managing adults. And there were portion of children though who had other problems like developmental delay. You know, they had neurological issues, they had seizures. They did get a severe illness and got admitted and got onto ventilator. Having said that, there have been one or two patients who've been absolutely well, who became unwell and landed up in ICU, but that portion is extremely small. So, like first wave, what we're seeing now is more of what we call as MISC syndrome, which appears almost a month after infection. It is to do with the immune response we see in children. So that seems to be a significant problem in children compared to acute COVID infection itself. And that rise is what we're seeing right now in Bangalore. Yeah, over to you, Raj. I think, yeah, so just trying to address these questions. And maybe we can hear from Dr. Vijay and Dr. Lakshmi too. What was their US experience? Was COVID a significant issue in the second wave in children there, or did it behave in a very similar fashion to first wave?
I'm happy to take this question. And Lakshmi, please feel free to chime in with your NICU experience as well, just to piggyback off of Dr. Rakshay's Indian children experience. So at Children's Hospital, we ended up having a special unit, and we noticed very similar trends where as the adult infections rose, the pediatric infections, the childhood infections also started rising. And we had two waves. And in both waves, there was a slight increase as it paralleled the adult infection, but it was manageable. We had children requiring different degrees of support. The very asymptomatic, exposed, mild to moderate children were managed just with symptomatic supportive measures with hydration, bed rest, and isolation, quarantine. And then we had the more moderate to severe that required oxygen and ended up requiring essentially additional therapies like steroids for the coexisting conditions like asthma. And then we would consult the infectious disease service potentially for the use of novel therapies like remdesivir, and we would consider the anticoagulation to prevent the blood clots from forming. The very severe and critically ill children were the ones that we managed in the ICU, where we would sometimes need to put a breathing tube and put them on the ventilator, and also consider these medications, including steroids and remdesivir, as well as anticoagulation. And mortality or death rate in these children was higher than what we typically see for all other illnesses. So COVID is a problem in children when they get very sick. But thankfully, the majority of children don't seem to get very sick, and they are very inefficient drivers of transmission in the community. Thank you. I'll hand it to Lakshmi now for her input on the NICU side, the neonatal side.
Yeah, thank you, Rakshay and Vijay. So I'm a newborn ICU specialist, and I have to say my experience in the newborn ICU has been quite different. Thankfully, COVID seems to be a disease that does not affect newborns too much. Maybe it's differences in their physiology, the receptors they have in them. But we've seen a lot of mothers come in with both asymptomatic COVID infection picked up on COVID screening tests, as well as symptomatic COVID infection. We're a high risk delivery unit. But and we've tested babies of all of these mothers, and actually at our local institution we have had very few to nil cases of positive babies. Across the country, there is actually a perinatal COVID registry which has been tracking mother baby dyads across the US, and I believe the UK also has a similar registry. And what they've seen is kind of similar. It's pretty uncommon for the babies to get an infection, even if the mom has an infection. I think they're quoting rates less than 2% of babies getting infection. And when they get infection, for the most part, again, babies do not seem to get very sick. They can get a fever, they can get less active, they may have breathing symptoms or not feed well or have vomiting or diarrhea. But for the most part, they do well. The higher risk categories for babies are premature babies, and also again babies with underlying medical conditions, say heart problems or other congenital problems. But for the most part, thankfully, babies do seem to be somehow able to not acquire the infection, even if the mother is suffering from the infection.
Excellent. I mean, that's quite heartening to see that the US experience was not very different compared to Indian experience. And this particularly is very important for us because, with the second wave, the experience was that a lot of young adults got infected, very seriously infected, landed up in ICU, consuming up all the ICU resources of cities, and it was a devastating experience. And with this, what happened was there was a lot of fear in the community saying that a third wave is going to come and that is going to affect children. And with US and for that matter UK too being in the timelines being ahead of India in terms of their first wave and second wave, it looks like there has been no increased incidence of children being affected. Is that a correct statement to make?
Yes, I think that is a correct statement to make because what we have seen is as the adults are getting vaccinated, particularly the older adults, the denominator is now shifting towards the younger population who are now vulnerable. And therefore, as a proportion of infections, children are now making up a bigger proportion, with also a good proportion in the 12 to 17-year-old range, the teenagers who are now becoming more vulnerable, and it is becoming more manifest because the denominator of the adults, the older adults, has gone away, thankfully, because of the increased availability of vaccine. And we now see the children. Again, children continue to have mild infection. A small proportion, as Dr. Lakshmi mentioned, with severe comorbidities like diabetes, asthma, or obesity, are the ones that end up landing up in the ICU requiring extra help. Oftentimes in children, we are managing with non-invasive ventilation, which is like the continuous positive airway pressure or the bi-level positive airway pressure. But a smaller proportion end up getting intubated and then require additional therapies. And we've even taken care of children on ECMO or the cardiac bypass for the very, very severe illnesses. But usually the majority of them have significant comorbidities, which predisposes them to a more severe disease manifestation. So the hope is as the vaccine gets licensed for younger and younger children, we will be able to manage this better and avoid having the infections that are manifest even in younger children with the use of the vaccine. I will hand it to Dr. Lakshmi.
Yeah, thank you. I agree with all that you've said, Vijay, in terms of how it's progressing in the USA. But I think a lot of that is definitely influenced by vaccination status, as you said, sort of helping the most vulnerable older population be somewhat removed from the risk pool now, and so we're seeing a relatively greater proportion of pediatric patients involved. I'm curious to hear from Dr. Rakshay if if he has any insights on newborns in India and whether what I said about newborn rates of COVID being low in the US, whether that seems to be holding true in India as well. I'd love your thoughts on that, Dr. Rakshay.
Yeah, thanks, Lakshmi. And I think the experience has been very similar here too. This time around, there are a lot of pregnant women who got infected, but thankfully, like what you mentioned, the newborn infection did happen, but it did not seem to happen in a much higher rate. And those who got infected too, many of them, of course, there are some case reports of some children becoming seriously unwell, but they are far and few in between. But I think the message to the public is majority of them do quite well, thankfully, in children. And also, it was quite interesting to hear Dr. Vijay's experience, and that's quite similar to what we've seen here too. Now, when we just because I had an advantage of managing adults too, what we notice in adults who become sick, they land up on non-invasive ventilation. What non-invasive ventilation means is that you give a positive pressure through a mask, and if that doesn't work, then you put a tube inside the throat and then you give positive pressure. The idea is to open up the lungs so that the gas exchange can happen. Now, this kind of treatment often takes in adults a week, 2 weeks, and many of them develop tremendous amount of complications, the heart becoming weak. Some of them have blood clotting happening in the brain, in the lungs, and many of them have a sudden cardiac event in the form of heart attack. So it's a very difficult and a serious disease, and it's not just limited to lungs. We might think lung is an important thing, but we have seen affecting brain, affecting kidneys, affecting liver, and many other organs. What we have noticed in adolescent children, like Dr. Vijay mentioned, there are children who are overweight. They did get infected. They did have pneumonia, and 90% of them, with just the non-invasive ventilation for few days, they recovered. There have been few patients who became significantly unwell, behaved in adult pattern, landing upon an invasive ventilator with a tube in the throat for almost a month. So, but thankfully, that percentage seems to be much lesser. So, just a question to again Vijay and probably Lakshmi, just because you're ahead of our curve, there is a lot of hoopla in the media, both print media as well as the TV media, saying that the next wave is going to be children, and the government also seems to be worried. They seems to be ramping up the infrastructure, saying that the children are not are not vaccinated. They are the ones who are going to become incredibly sick, and we need to prepare for the second wave, for the third wave. So, what is your opinion on that? I mean, is it that even in US you're thinking in terms of children getting more and more sicker with the coming third wave, or do you think it's the experience of last two waves has suggested that they're unlikely to become sick?
Lakshmi, do you want to take that first, and I can follow
Yeah,
you?
I can start. I think we have to be cautious in predicting the future because this virus has thrown us for a loop so many times already, right? We've all had, premature declarations of, having controlled it only to face another wave. So I think I'll answer that question with a bit of caution. I think it's heartening to see what we've already seen with our experience with children getting the infection and in general not having as severe outcomes as adults. However, I think there are some variables in the mix that we don't truly understand yet. In the US, for example, the early low rates, I think many children have been home for much of the year. Questions that remain are how are things going to be once children go back to full-time school or if masking mandates are removed. What is the contagiousness of this virus going to be, and what are the rates of infection going to be? I think the other variable in the mix is the new variants and how they're being reported to be more contagious, more sticky, more easy to transmit from person to person. So I feel like that is another variable in the mix that I'm not truly sure how it's going to impact the rates of transmission across children. I do think we know a little bit about the severity of illness, and so that piece is heartening, especially hearing Dr. Rakshay and Dr. Vijay's experiences in the pediatric ICU. I think that aspect is heartening, but I do feel that we need to sort of continue to watch with caution. So that those are my sort of preliminary thoughts, but I'd be interested to hear what the others have to say. I feel like there still needs to be a sort of staged and phased approach to closely monitor rates in the communities to sort of make decisions about lifting some of these mandates. So it has to be done very cautiously and with thought, because the pediatric population is not yet vaccinated. But that is sort of based on both my experience as a physician here and as a parent of young children here. Yeah, I'll hand it over to Vijay for his thoughts.
Yeah, I can follow up with what Dr. Lakshmi said. Thank you for that good question, Dr. Rakshay, because we're all worried. And as Dr. Lakshmi said, we're all parents as well. We also have young children, teenagers, some of us, and even older children. So
Yeah.
I think one of the, in addition to what Dr. Lakshmi said, I fully agree with her concerns. We have to be cautious. There's two other things that I worry about as we sort of go into the future, particularly from the context of India, where it is so tragic and heartbreaking to see all these scenes that we are seeing with the collapse of the healthcare infrastructure in many places, which has really been, it is like a punch in the stomach for all of us that we are sitting here far away, unable to help, and we are all, feeling the pain. One thing I worry about is the healthcare capacity, because as children get infected, if there is increased infection in children, as they seek healthcare, will the healthcare infrastructure be able to cope? And if the healthcare infrastructure cannot cope, because one of the things in India is we are seeing a lot of pediatric centers in India, like you run a fantastic unit, Dr. Rakshay. But at the same time, there are many other cities that don't have the infrastructure. If those children there get sick, what is the capacity to manage them and what will the outcomes be? So that is one thing I worry about. In the United States, we do have capacity. There is a lot of children's hospitals. There is a lot of places to move them around. So I think we can manage, and we're learning very quickly, just as you are learning in India. We're learning how to manage this disease, which is seeming to come at us in different directions. So that is one thing I worry about, the healthcare capacity. The second thing I worry about in the case of children is children have a lifetime ahead of them, and we don't know what the long term sequelae of COVID is going to be when you get infected because this is such a novel disease. We do not know will this behave once it affects a child in about 10 years or 20 years or 30 years when they're adults. What is it going to do to them? Will it affect their general health? Will it affect their psychological health? Will it affect their longevity? We do not know. So it is extremely important for all of us to be very careful in how we make predictions. So we should be prepared. Better to be over prepared and then have to deal with a lower level of intensity, and we can always stand down. So we have learned lessons from the first wave, second wave, and I hope we can really put that together to protect children who are our future and who really will carry our generations forward. Thank you.
Yeah, excellent points. Before Raj takes over, just a couple of points to what you've added. So, what I can summarize from our discussion with both of you is that anything about this virus is unpredictable, right? So, everyone who predicted things and have turned wrong. So, it's very difficult to make conclusions based on our past experiences about what future might hold. So, the second wave, the government focused on vaccinating people 60 plus and 45 plus with comorbidities because that was the experience of the first wave. And unfortunately, what happened was the young population got affected. There was mutations. The Delta variant seemed to create a havoc. Now we don't know what this virus is going to do further. So it is better to be watchful, better to be prepared, both in terms of our own precautions, uh, in terms of following hand hygiene, masking up, as well as maintaining social distance, as well as from a healthcare point of view, you feel that the government approach is good in the sense that they are looking at this third wave affecting children and ramping up the healthcare services. What you said is correct. Most of the pediatric intensive care services in India, at least, have been focused around big cities, and the small districts, unfortunately, don't seem to have that kind of healthcare facility to cater sick children. So, from this point of view, I think government focusing on ramping up the healthcare services for children is a good idea. And the final point what you mentioned was a really important one. And like you said, in adults we've seen these patients what we call as long COVID and chronic COVID. Many of them having so many other issues, despite having a mild infection, they seem to be carrying a lot of problems later on. What happens to children is an unknown entity, so we really don't know if it's going to affect them later or not. That is something the time will tell. But those are excellent points, Vijay, and thank you very much for bringing those up. So over to you, Raj.
Yeah,
Hope,
thank
hope you
you.
can hear us now. Yeah.
Thank you so much. I mean, we have audience who are doctors, who are also audience who are, parents who are very concerned and curious to know about more about their. So here's what I saw in the news. So let me put that on the screen. So, this is from Hindustan Times that said children are vulnerable to COVID-19, but fortunately, majority are asymptomatic. And on the other hand, New York Times says, why are so many children in Brazil dying from COVID-19? So, as a parent with young children, so what should I make sense out of this? So, you know, Dr. Vijay, if you want to get started.
Sure, absolutely. And I think this again highlights how, we are experiencing COVID in different parts of the world differently. And I think that is why we cannot use a one size fits all. We have to do it based on local conditions, regional conditions, national conditions. And a lot depends on the healthcare infrastructure as well as how many other sort of, diseases are in place at the same time. So again, Brazil, when you think of it, it is a very urban areas with largely unpopulated, sparse, jungle areas with the Amazon forest.
Mm-hmm.
So again, a lot depends on and there's a lot of urban slums in Brazil where children live in very close proximity. And again, the question is, are they not getting care for other conditions? Is it being attributed to COVID? Is it COVID plus something else? So there are a lot of unknowns. And I will just sort of briefly mention, we were very worried about Dharavi in Mumbai, in India, that we said it would be like this big epicenter. But surprisingly, in Dharavi, for whatever reason, things have been really not as bad as we feared.
Yeah.
And in fact, many other cities that we thought would not be hit got hit very badly. So it's so variable. And I think all we can do is continue to monitor, which is why I think going back to testing, tracing, even if it is a big, sort of explosion of cases, we still have to be vigilant with a lot of testing. We cannot stop testing. And as Dr. Rakshay said, and as Dr. Lakshmi also pointed out, simple measures like social distancing, masking, and hand hygiene, those are the most effective tools we have. And doing it to the best of our extent. We recognize when you have young children, you cannot isolate them. They want to come and get a hug. The human contact, the human, tendency to hug a child is so important for their mental health that is far outweighs the, physical danger of getting COVID. So there are those practical considerations. But from what we are understanding, as the vaccination rates are improving, and hopefully it will pick up worldwide, we also know that transmission to children within the same household, as we are learning now, is also reducing remarkably. So it is actually within the household. Once you have a COVID positive adult, it is very unlikely once you're vaccinated that the level of infection is high enough that it will get transmitted to the child. So this is all heartening news.
Yeah.
So the way to go forward is to keep these measures in place while we seek out the vaccine and get the vaccine in place.
Okay. Thank you. I think I see Raksha, is there anything you wanted to add?
No, I think it's just not related to this question, but I think one important comment both Vijay and Lakshmi made was that how vaccine is changing the demographic of infection, and that's been the experience here too. So thankfully, because the elderly were vaccinated, we didn't see that many elderly patients coming to ICUs. So which means vaccine really works. And there's a lot of this concern initially about people not wanting the vaccine, making sure the vaccine is going to work or not. But one thing was very clear that the critical COVID infection, which lands up in ICU and lands you up on ventilator, that barely ever happens. Of course, there are few case reports, but then they're far and few in between. So it does work. And I think it goes on to say that a lot of adults who are listening to this webinar, they should strongly consider themselves vaccinated. Because I think right now we don't have a vaccine for a child. But I think if you were to protect a child themselves getting a vaccine, like what Dr. Vijay mentioned, it significantly decreases your viral load, even if you were to catch an infection and your chance of infecting a child. So I think that's a good point. And I think, again, brings up across the world, it has shown that it's a very, very good tool to prevent COVID-19 infection.
Yeah, I think, thank you for the point. I do have a comment about the vaccine that will come back in a little bit. In the meanwhile, there is a question from the audience that says, this is probably for Lakshmi. So while COVID positive mother breastfeeds, our antibodies are passed to baby, and won't antibodies harm the baby?
Thank you for that question. Antibodies are actually the strong defense mechanisms, produced by our body against the virus. So in fact, by breastfeeding babies, and the data that's coming out showing that antibodies against the virus are being produced, that is actually showing that we may be actually passing on some protective mechanisms to the baby against COVID-19. So, in fact, all the major organizations across the world have come out in support of breastfeeding, no matter what the mom's condition. So even COVID positive mothers are encouraged to breastfeed, but with all the precautions, the same precautions we've talked about: masking, good hand hygiene before touching the baby. And actually, if the mom has started producing antibodies, she may be passing them on to the baby to protect them. Similarly, a COVID vaccinated mother, there is some evidence to say that antibodies against the COVID virus may be passed on to the baby and actually be helping the baby with additional protective mechanisms against the virus. So I would say, we're strongly encouraging breastfeeding whenever it's feasible. If mothers don't want to directly breastfeed, they can, and if they have the resources to do expression of breast milk and give that to the baby, especially during an acute infection, that is also an option. But there is no contraindication or no downside to breastfeeding.
Okay. So, to summarize, it is important to continue breastfeed like how people used to do before, with the exception of following COVID precautions.
Can I ask one question to Lakshmi on the same lines of breastfeeding?
Yeah.
So if a mother is infected and she's on medications, there's a
Mhm.
common concerns. The families do ask, like, you're on blood thinners like rivaroxaban and medications like steroids. Is it still safe to feed the child during acute COVID infection?
Yeah. So in general, like I said, for the COVID infection itself is not a negative to breastfeeding. As I said, as long as the mother does because what we know about transmission of COVID from mother to baby is that if it happens, it probably happens the same way it happens between adults and children. It's through respiratory, droplets and aerosols. So the masking and the hand hygiene are still the tenets to prevent transmission. In terms of the medications the mother is on, that needs to be something that the mother discusses definitely with her obstetric provider to ensure that those medications, the specific medications, are they medications that are regarded as safe for breastfeeding or not. And typically the obstetric providers will be able to help the mother with the guidance about whether the medications that mother is on are safe for breastfeeding or not. So the list of medications should be gone over in detail with the obstetric provider to ensure that they are okay with breastfeeding. But for the most part, many medications are not easily transmitted in breast milk. But again, depending on the specifics of the case and what the mother is on, it is worth a detailed discussion about the medicines. So to summarize, the infection itself is not a reason to not breastfeed as long as precautions are taken. The medications, the mother should have a discussion with her doctor about what those medications are and whether they are safe for breastfeeding.
Okay. Okay. I think we lost your audio for a few seconds. Okay. So I think I got the message. So essentially, continue breastfeeding just like before with COVID precautions, and do check with doctor if the medicines are safe to be taken because the mother is breastfeeding. Perfect.
Can
Thank you.
I just add one comment, Raj?
Yeah.
Yeah, yeah. So I think that's a very good point which Lakshmi has brought out. And unfortunately, what we noticed in adult COVID is a lot of people on unnecessary and needless medications. We have
Uh-huh.
seen patients being put on drugs like doxycycline, azithromycin, ivermectin, favipiravir, and we know that none of these medications do work, right? And there's a lot of anxiety in general population. People want medications, and doctors are happy to prescribe sometimes medications which are far too many. And here we're talking about two lives. So there are very few medications which work. So remdesivir to an extent, steroid to an extent, and sometimes blood thinners in really patients who need admission and who've been unwell. So there are very few of those medications actually work. So I think it's important to limit needless medications given for mild COVID infections at least, because then there's a concern about feeding child too.
Yeah. Yeah, no, that's great. So you did mention about blood thinners. I want to remind the audience that next weekend we will be talking about blood thinners, bleeding and clotting. So do tune in. So on the same note, I do have a question that says, but do COVID antibodies cause cytokine storm? Some gynecologists are against it. Even vaccine is suggested to take after a year after delivery. I'm just reading exactly as the question is. So is there anything you want to comment on, Dr. Lakshmi?
Could you repeat the question,
Yeah,
Raj? Sorry.
but COVID antibodies cause cytokine storm? Question mark. Some gynects are against it. Even vaccine is suggested to take after a year after delivery? Question mark.
I see. So, in terms of first of all, in terms of the vaccines, some vaccines, so the history behind the vaccines is unfortunately the trials of vaccines, did not examine pregnant women. So, we're only gathering our data on pregnant women more recently with real world vaccinations. In the US, vaccines have been made available. A couple of the mRNA vaccines, the Pfizer and Moderna vaccines, have been made available to pregnant women. And now hundreds of thousands of pregnant women have taken the vaccines. And they're also being encouraged to report any side effects into, a vaccine registry that's openly available. And so far, we are not hearing any reports of major adverse effects from vaccination during pregnancy. Now, these vaccines, different vaccines are available in India. It's Covaxin, Covishield, which we do not yet. I know that there is still ongoing evaluation about safety during pregnancy. But once vaccines are made available to pregnant women, I think the overwhelming feeling is that getting the vaccine is much less risky than actually getting the infection, because we do know a lot about COVID infection in pregnancy and how it does seem to, in some cases, cause severe illness. And data coming out showing increased rates of preterm birth and severe illness in mothers suggests that the COVID infection in the mothers is high risk. And if COVID vaccines are made available by the governing bodies, I would say that it is the right thing to do for pregnant women when compared to the risk of infection. I know that it's not yet available in India, but definitely in the US, for the vaccines that have been made available, pregnant women are being offered the choice to vaccinate during pregnancy. Does that answer the question, Dr. Raj, or was there a part of it that you think I've missed?
No, I think it did. And again, so I want to ask the person who asked the question, if something is not clear, please do type in more questions. So,
Raj, can I just comment?
Can I make one? Yeah, please. After Dr. Rakshay, I'll make one more comment. I completely agree with Dr. Lakshmi, but after Dr. Rakshay, I will make a comment.
Yeah, so part of the question, I think what they raised was the antibody transfer to the newborn by feeding, whether it can create a cytokine storm in newborns. Apparently, some of the obstetricians are telling not to feed because that can cause a cytokine storm in newborns. Any comments on that, Lakshmi?
I do not believe there's any evidence to that effect. Thank you for clarifying that, Dr. Rakshay. I didn't realize it was related to breastfeeding, but yeah, so we think that the antibodies that are transmitted during breastfeeding are protective. And we have seen no evidence to date suggesting that any kind of cytokine storm emerges from this antibody transfer during breastfeeding. So I would say that is sort of not something to defer breastfeeding due to, because we're seeing no evidence of that.
Okay. I agree. I agree with Dr. Lakshmi, because I think antibodies that are transferred are typical to any other infectious disease where there is passive transfer of maternal antibodies to the infant, the newborn, and if anything will confer some protection if they've already had the infection for at least a short period of time while the immunity wanes. So there is no reason to believe this should be any different. And I fully agree with Dr. Lakshmi. I want to make one more comment. There is a myth going around that the vaccines are causing infertility problems, or there is a risk.
Yeah.
There is really no evidence to suspect that. It is at least for the mRNA vaccines, and then you have the viral vector vaccines. Again, data is limited, but there is really no reason to suspect that will happen as we continue to collect and track data from all over the world. So far, from the United States, we have not sort of heard any alarming reports or anything. And the usual problems with infertility will continue to remain as women put off childbearing to older and older ages because of economic, considerations and other things. There are other factors, including pandemic-related economy depression, that has probably resulted in people putting off having babies because everybody has lost jobs and we don't have a steady source of income. So to link the two and say vaccines are going to cause infertility is a little bit of a stretch, in my opinion, and I disagree with the claims that are being made.
Okay, so that's great. So presently there are no claims to say vaccine causes infertility. So if someone is eligible, they can continue to take the vaccine. And second is breastfeeding does not cause any cytokine storms. So if breastfeeding is indicated, so please do continue breastfeeding with the usual precautions that Dr. Lakshmi mentioned. All right. So we do have another question that says, what tests are done if the child is suspected to have COVID? So Dr. Rakshay, you want to take this?
Yeah, so it's a good question, because this is something I hear quite often. Because a lot of adult COVID patients, they go through a battery of tests. Some of them are appropriate, some of them are inappropriate. But then there is, the virus in adults behaves very differently. So they have this viral phase where there's virus in the body for 1 week, and then second week they develop a body's immune response, or what we call inflammatory phase. And that is where a lot of people tend to land up in trouble with. They develop pneumonia and other complications related to that. So to identify that phase, especially when there are symptoms, for example, persistent fever, fever which reoccurs in the second week, someone saturation dropping to less than 93%, someone developing intense severe cough in the second week. So certain tests are recommended in them. Are those tests, for example, I think now everyone knows, when we had this dengue epidemic, everyone knew what platelet count was, and people used to come every day and ask, what's my platelet count? What's my platelet count? Now, the same story has happened with CRP. Looks like everybody in the general public know what CRP means. And in fact, it's quite interesting that we had an admission a couple of days back because the CRP of a child was high and the child panicked and child wanted to come to the hospital. So to that level now, people have become aware about every test done in and around COVID. So these tests like CRP, CBC, D-dimer, I think now everyone knows that these tests are done for adult COVID. Now, a lot of children, parents also want to know, these things are done for adults. What about a child? Should we do all those tests? A lot of CT scans are also done on second week, and there are specific indications though, but some of them are indiscriminate CT scans are also done. But do we need those for children? So the answer is no, because even in adults, we discuss very specific where those tests are needed. Like in the second week with those complications, what I mentioned, those are extremely uncommon in children. There will be a certain set of children, but then you don't have to go on doing tests just because child is COVID positive.
Yeah.
You don't have to do a child because child had just fever for a day or two. But if a child develops a complication related to COVID, we might order some tests. Having said that, in children, what we've seen is a condition what we call as MISC, which appears around 2 weeks to a month after acute COVID infection. There's a recurrence of fever in them, which goes beyond 4 to 5 days. Some of them develop loose motions, stomach pain, vomiting sensation, rashes, red eyes, red tongue. In them, we do certain amount of tests because it's a lot of tests are important to figure out whether you are dealing with post-COVID MISC.
Okay, so
Yeah.
we do have a question on MISC actually. For our non-physicians, can you just explain what MISC is just briefly? And then the question says, how much is the incidence of MISC in children in practice, especially in second wave? How are we going to prepare to tackle it in future?
Yeah, so I can take up this question, and Dr. Vijay can add his experience too. So MISC as such, the incidence is not too high. It's not that every other child who's going to develop acute COVID is going to develop MISC. One of the articles which is published in JAMA, it said it's around 1 in 10,000. So its incidence is not too high. I'm sure it might vary from country to country, but generally speaking, it is not a very, very common condition, but it can happen in a small fraction of children. So why it happens, we really don't know. I mean, there are various theories floating around. One theory says that when you have an acute COVID infection, you might produce some antibodies which fight against our own body. We call it as autoantibodies. So these autoantibodies can cause problems by attacking your own body cells, and they do manifest couple of weeks to 6 weeks, in that range after the acute COVID infection. Now, this is an interesting condition in the sense that many times when patients or children do come with this condition, what we call as multisystem inflammatory syndrome in children or MISC, they don't have an acute COVID history. The majority of them are asymptomatic, and if you ask them, they would say probably we had a day of fever, or majority would say the parents had fever, parents were diagnosed to have COVID, and children did not have. So oftentimes it tends to be asymptomatic COVID infection, and a month later, what we call as multisystemic inflammatory disease happens. So the characteristic of this condition is that you have fever, and you tend to have either heart involved or some organ involved in the form of skin, occasionally liver. So there are more than 2 organ systems involved. So the blood system gets involved, heart gets involved, skin gets involved, and sometimes the gastrointestinal system. Some of them present with severe stomach pain. Many of them in the first wave are misdiagnosed to have appendicitis. They almost land up on surgeon's table. So it can cause that kind of severe abdominal pain. It's not uncommon. Many of them were diagnosed as enteric fever or a typhoid fever. But I think what is happening now is the general public as well as the doctors are becoming more and more aware of this condition. In effect, however, what is happening is a lot of overdiagnosis of this condition is also happening. I've seen few children who were referred to as MISC, but they turned out to have urine infection or a typhoid fever. So it's important to evaluate them correctly, but just in a simple fashion, it's probably because the body produces some antibodies which fights against our own cells and creates complications. I think Dr. Vijay also wanted to pass some comments in the last question, and this might we can hear his opinion too.
Yeah, no, thank you, Dr. Rakshay. I fully agree with your assessment and characterization of this multi-system inflammatory syndrome in children known as MISC. It is similar to what we used to sort of see with rheumatic fever and post-infectious glomerulonephritis, in that it is an inflammatory response following an infection, or in some cases, as you said, it might just be an exposure with that immune system primed to behave in this way. Agree with your assessment also of the prevalence. It's really low. We're still trying to characterize it. The criteria are also evolving, and really largely it is, as you said, in some ways when it's associated with myocardial dysfunction, which is when children become even more obviously ill and can present in shock with the other GI symptoms that you described. Early on, there was a lot of thought this was very similar to another condition called Kawasaki disease, which would behave similarly. But there are some similarities, but there are also some differences, clearly, because this is associated with COVID, and it often follows that peak. So one thing to keep in mind in surveillance is when that peak happens, usually be a few weeks later when we are seeing these MIS-C cases. So now that India has had the peak, we have to be very vigilant for a lot of these children with MIS-C in the next few weeks to make sure we're not missing anything. Because as you said, if they don't get the right care at the right time, they could present in extremis, and they can actually die from this condition if the supportive care is not provided with all the necessary ICU-related supportive interventions. So I'd say that is sort of an important thing. And the other key thing is, as you alluded to, they are really not capable of, transmitting the virus. They're not actively infected. So those children should be, well cared for. There shouldn't be any stigma that they can spread or, do that. Usually it is, it's like a post-infectious immune mediated problem. So that was the other point that I wanted to make.
Okay, thank you. Moving on to the next question. How should parents think about risk of exposure to unvaccinated children on seeing other kids? Given that most likely in India, well, most of the world, vaccination will take a while, what activities can kids do? So whoever wants to take this? Raksha, you want to take this?
Yeah, sure. I mean, it's so like what we've been just discussing. We don't have a vaccine for children as of now. Of course, there are some trials going around. There is a trial going around with the Pfizer vaccine for adolescent age group, and the Covaxin in India is undergoing a trial in 5 to 12 year age group, and there are a couple more vaccines in that age group where trials are going around. So meanwhile, I think the safest way for us to prevent infection in children is at least immunizing the adults, so that the household transmission of COVID becomes much lesser. So if your parents, both of them vaccinated, it's very unlikely that they would transmit. It doesn't become zero, but the viral load is significantly less, so that chance of transmitting infection becomes less. So meanwhile, I think whatever routine precautions what we are following, masking up is as good as vaccine. So
Yeah.
who are children who are big enough to mask, continue masking, continue your social distancing as much. But I guess once we get to know more and more about vaccine and its efficacy in children, probably vaccination is the only way going ahead to kind of prevent infection happening in children.
Yeah.
Yeah, no, I agree with Dr. Rakshay as well. And I think I would also like to hear from Dr. Lakshmi. But I agree with Dr. Rakshay that I think the key is following these simple precautions. And a lot also has to do with the density of transmission. Because when the peak is high and there's a lot of cases, it is very prudent to keep the children safe and prevent them from getting infected by using the measures. But once the peak starts falling down, I think it is also hopeful to see that children can actually continue with their activities, especially outdoors, whenever possible, when there's good ventilation. They can continue to remain masked but still engage in activities. So there is the socialization, which is so important for children as they continue to grow and develop.
Yeah, absolutely.
Yeah, completely agree with those comments. I think knowing your, to summarize what Dr. Rakshay and Dr. Vijay said, which I totally agree with, know your local rates of transmission, right? If your local rate is high, you need to be more safe in your in sort of keeping your kids safe and maybe not engaging in so many group activities. But as community transmission goes down, I think outdoor activities but masked, because our kids are still not vaccinated, I think that's the way to go. And not gathering in big groups and continuing to maintain social distancing and masking are the key. And obviously, as these vaccines become available to different age groups of kids, that is going to be the ultimate protection. And we're all waiting eagerly for that in terms of vaccines being available for kids.
Yeah, no, that's great. So the next question says, how to take care of children if parents have tested positive? I think you might have touched this on. And the same note, it says, can children be super spreaders? I guess we can hear the Indian perspective and then the US global perspective on this.
Yeah, so just to answer this question, I mean, see, one of the fear with the children is that children are children, so young children, it's incredibly hard to maintain the social distance. They come and hug people, so there's a potential of spreading infection. One of the case why people have been talking about vaccinating children is because let's imagine it tends to be a milder illness even in the next wave. What potential can happen over time is that children can become reservoir for COVID infection because they are the only non-vaccinated group. So what can happen then is they can become a source for future mutations, and that mutation can again cause one more wave for rest of the population too. So that concern is there, because of holding on to virus which undergoes mutation in your body, because the virus also wants to survive. So
Yeah.
it's going to find its own way to survive and spread infection. And now only source of infection is children, and then it undergoes mutation and learns to spread the infection to the rest too. So that possibility is always there in terms of them becoming a focus for future spread.
Anything you want to add, Dr. Vijay, Dr. Lakshmi?
I can mention in terms of the spreading ability, I think the studies looking at nasal respiratory virus carriage, which have shown that children also carry, a decent amount of virus in the nasal passage. So I think there is always that, a potential for spread. So I agree with what Dr. Rakshay said. I think, was there a part of the question around parents caring for children?
Yeah,
COVID
how to
positive?
care a child if parents have tested positive?
Yeah, that's a good question. Now, if the child has been exposed to the parents, which is obviously going to be the case, the child has to also be quarantined in isolation. So one of the important things is they should not come in contact with other unexposed individuals. That's one piece of it. Depending on the age of the child and whether there is another care, if the parents are ill, they may have to identify another care provider who can care for the child while keeping them isolated. But if the parents are infected and are feeling well enough to care for the child and have no other person available, then they should mask, they should do hand hygiene. So it's kind of the same things, try to minimize risk of transmission within the same house during the period of infectivity, which is like 10 to 14 days after the onset of infection.
Sure.
Yeah.
Okay.
Yeah. And recognizing, I agree with Dr. Lakshmi and Dr. Rakshay's points. And it is hard, right? Because many people often do not have large homes. They may only have one room the family is living in.
Yeah.
It is very hard to isolate and do all the things we suggest so easily. But real life is very hard for most of our patients and their families. And most of us, we all can try and make these guidelines, but it is so hard to follow. So I think it is important to consider all these, subtleties, and this is where the community, the village, we all need to sort of help each other, where we can try to come up with good creative ways to enforce the social isolation as much as we can, distancing rather than isolation, physical distancing, masking, and trying to do those simple measures to prevent further spread of transmission. Any high risk activity, we can avoid it. We should avoid it. Try to do the simple things of daily living and avoid like extensive congregations and extensive get-togethers and mass gatherings at this time. It is only for a temporary period, and that is what I like to re-emphasize again and again. It is but a small phase in our life as we are dealing with this massive pandemic. We have to get through this to the other side, and everything we can do as an individual, as a family, as a community, as a society, as a nation, as a world is very important to try and mitigate and minimize the risk of transmission.
Very well said.
And I think sometimes this whole word social distance is the wrong word. It's talking about,
Right.
it should probably be said as physical distance.
Yeah.
You don't have to distance yourself socially or emotionally. And people think about social distance, there's an emotional disconnect, there's a social disconnect. There are different ways of still socially meeting up, still having emotionally connected, but maintain physical distance.
Yeah. All right.
Fully agree.
The next question says, have you seen any mucormycosis case in children? Well, Dr.
I
Lakshmi,
really
with your expertise with, all the infections you take care of, and Dr. Rakshay from an Indian perspective. So what do you want to say about this?
I can start in saying that, I mean, obviously we have not seen mucormycosis in children, at least in the US. And I think from what I've read from Indian data, it does not seem to be a condition that's affecting children. But I'd like to hear what Dr. Rakshay has to say about that.
Yeah, I agree. I mean, and I thought a question about this black fungus and mucormycosis is going to come because we've seen quite a lot of adults who are presenting with this complication post-COVID. But thankfully, in children, there are a couple of case reports which are coming. If one case report, though, I think it was a diabetic child. I mean, we used to see mucormycosis in children too earlier. I mean, right now people get to hear about this, but then this was a known complication in uncontrolled diabetes, even in children. It used to be a complication. And even now, there have been children who have been identified to be having a COVID-related mucormycosis, essentially was related to an uncontrolled diabetes. However, there are some case reports coming with younger children getting affected, but then I think we need to look at those cases in detail. But they're far and few in between, extremely rare complication. And the current available, whatever reports we have seen, I think we have other comorbidities apart from COVID.
Mm-hmm. Okay, that's great.
I just asked Dr. Vijay also, what's the US experience being with the mucormycosis? It sounds more like a problem which we've noticed of late in India. In the first wave, there were incidences in patients, adults who had recovered from COVID, who had this black fungus invading into the eyes and sinuses and entering the brain. And that has reached a kind of an epidemic proportion with this wave. And there are a lot of people pointing towards use of steroids, pointing towards use of a cloth mask, excess use of zinc, and many other things. But it sounds like it's a problem very much restricted to Indian subcontinent, or India at least. What's been the experience in US? Have you come across this kind of reports in adults too there? Or?
Yeah.
That is a good question. And Dr. Rakshay, I think this is, as you're rightly pointing out, quite a uniquely subcontinent phenomenon in India. We are not hearing of this in the US, in the adults. And in fact, many adults in the US have risk factors like obesity, diabetes, and as well as immunosuppression for immunocompromised states for various reasons. And we have not really come across this as a mass phenomenon as it has been happening in India, which makes me worry. What are the unique factors in India? It is this, I mean, there's a lot of diabetes in Indian adults. I think that is really, a problem. And not just diabetes, but pre-diabetes. I think that is a very big condition in India that is increasingly a problem because of our, recent sort of rapid changes in diet, which have not sort of really helped us acclimatize to what our bodies are typically used to going back to centuries. So I think that is one problem. The second thing, I think you hit the point very well, Dr. Rakshay, is the use of steroids, but not using it carefully enough for the right period of time. I worry that steroids are being prescribed a lot, and they're being prescribed without enough regulation and monitoring, so we don't use it for the right amount of time. And it is just, again, like, he is getting it, so why am I not getting it? It is the same thing with the lab tests, the CT scans, everything that we are doing. So we have to be very careful and very judicious in the use of steroids, just like we are doing other medications. It is not to be trivialized. I think as we sort of, recognize we've created a new problem as we're trying to solve one problem. So we have to be very mindful and very careful. And I appeal to all the physicians in India to think about this very carefully when you prescribe steroids. Yes, they are life-saving, but you want to be careful and use the lowest possible dose for the least amount of time.
Yeah. And probably also the same thing for parents. Maybe they should ask the physicians if they really need steroids, and if they do, just make sure they're getting the appropriate amount of dose and not too much.
Yeah, I think one fact, again, we don't know all the factors involved in mucormycosis, and I think the points raised about underlying diabetes risk and the steroid exposure are probably important. Another factor may be at play, which may be antibiotic overuse too, like azithromycin is getting overprescribed. So are we wiping out, normal bacteria that line our body, and is that creating an opportunity for the fungus to overgrow? We also don't know that. So similar to the appeal to be judicious about steroid use, I would like to echo that we need to be judicious about antibiotic prescription as well during this time.
Mm-hmm.
Yeah, I mean, it sounds like a very complex problem because there have been various conditions where people have used steroids and have not noticed so much of mucormycosis. Various rheumatological conditions, the rheumatologists say we've been prescribing steroids for very long. We have not come across this condition. So it could be something very unique about the immune dysregulation, which probably happens with mucormycosis, coupled with like what you mentioned about diabetes. I mean, it seems like diabetes also has reached an epidemic proportions. A lot of young adults whom we have seen getting admitted with COVID have sugar levels been very high, and many of them were diagnosed for the first time when they got admitted with COVID. And along with that, probably many of them harbor mucor in first place in their nasal sinuses because of the tropical weather conditions and use of industrial gas and many other things, and excess use of antibiotics, excess use of steroids. Probably they're multifactorial things, which is kind of creating one new set of problem which we are facing. But thankfully, I think children being asymptomatic carriers for the most part of the time, not really landing up getting admitted, probably have escaped this deadly complication.
Mm-hmm. Okay.
No, great points, Dr. Rakshay. I think you really covered all the other additional factors that are so unique to, our tropical weather as well as, the risk factors. And you bring up a good point. People use steroids for other conditions for long periods without having significant side effects. So why this? I think that definitely is a big point here.
Yeah. So the next question says, what about ivermectin prophylaxis? Can it be given? I assume this is in children.
Well, I
Yeah, in
think
the United States, sorry, go ahead, Dr. Rakshay. Go ahead.
go ahead, Vijay, please. Yeah.
I'll just say a quick thing, and I'll invite Dr. Rakshay from the Indian perspective, I think, where
Yeah.
it's more relevant. We don't recommend ivermectin prophylaxis here in the United States. It was studied earlier as a possible potential, thing when it became, used in other parts of the world. But the CDC and FDA have not found any evidence that ivermectin used either for therapy or prophylaxis is beneficial.
Yeah, so I think I would echo similar things. So the first wave where it happened, people were consuming hydroxychloroquine with the hope of not catching COVID. Then the ivermectin became the next drug. So this question about prophylaxis means you're talking about preventing a COVID infection by taking ivermectin. I don't think it has any evidence base. There is a recommendation about mild infection by the AIMS protocol. However, having said that, there is no strong evidence to suggest that it might be useful drug even in mild COVID infection.
Okay. So there is an interesting question that does the immunity level in the male child and female child different? If so, which gender will be severely affected in case as predicted, probably when the third wave emerges?
The studies have shown that male got affected badly compared to female.
Mm-hmm.
There was a male discussion in terms of the mortality. That was at least the Western data. So Indian data, we are not very sure whether it has a specific gender, a specific mortality.
Mm-hmm.
But there have been few reasons explained in terms of the hormonal and the immunity response, which is slightly different in male versus female. But there is some data to suggest that it probably in adults, it's a deadlier disease in male compared to females.
Mm-hmm. Well, I think, just to summarize, as a parent, as a child, you should not worry about what gender you are. Just continue your normal precautions and, just be safe.
Yeah, I agree. I think pre-pubertal, before puberty, the differences in gender in terms of disease is probably very unlikely. Post-puberty, again, it's in the older population that we are seeing these differences in the United States, where older adult males are at high risk. So I agree.
Okay, so this is for Dr. Lakshmi. It says today I saw a report in media of a 20-day neonate who was COVID positive. How common is it? How to manage?
Yeah, thank you for that question, Dr. Raj. So we do see occasional reports of young neonates getting infection, and as I mentioned earlier in the talk, we think the mechanism of getting the infection is typically from someone who's infected around them, either an older child or adult who has the COVID infection and is transmitting it via droplets or as aerosol to the neonate. But again, it is a pretty, as I mentioned earlier, it is quite rare for young babies to get the infection, but it's not impossible. And they can have a range of symptoms. A lot of the time, thankfully, it's mild illness. But again, given the age of the child, less than a month old, this is important to be in regular communication with your pediatrician to ensure that you're giving the baby the right supportive care. So, just like any viral disease, management of fever, keeping the baby hydrated, supportive care, watching their breathing, making sure that they are not in distress with their breathing, making sure they're not vomiting so much that they're getting dehydrated. These are all the supportive care measures that are needed. And again, if you're worried, having the baby seen by the pediatrician to decide whether admission to the hospital is needed is going to be important. But every case is going to need individualized attention to decide whether home care is appropriate or whether the baby should be admitted and management done in the hospital. But the treatment primarily is going to be supportive care, keeping the baby hydrated, and if the baby needs respiratory support, giving oxygen and things like that are going to be the management needs. The need for a ventilator is probably very unlikely, but again, we've seen some occasional cases of babies needing ventilators, especially if they have other underlying medical conditions or if they are premature. Yeah.
Okay, thank you.
Sure.
Dr. Vijay, I know you probably have to go, and I thank you so much for being here. So we will still continue our questions with Dr. Lakshmi and Dr. Rakshay. I really want to thank you for just shedding your expertise and helping people out here.
Thank you, Dr. Raj, and to my co-panelists, Dr. Rakshay and Dr. Lakshmi. This was a pleasure to be here, and all of us, we are in this together, and our hearts are in India with our, everybody there, and we all, as I said earlier, we feel the pain, and we all want to be in this together, and we hope we will be seeing some very good times very soon as we get through the other side and all get to better times.
Yeah.
Thank you, Dr. Raj, for having me.
Thank you.
It was wonderful interacting with you, Dr. Vijay. Thank you very much for a very useful insights.
Thank you. Thank you so much.
Thanks, Vijay.
All right. So next question is, are there any booster vaccine for improving immunity in children? So before we get to answer, I have to say that there is an entire COVID vaccine series videos, and so do check the description below where you can find a lot of videos. And I have to say, Dr. Rakshay and Dr. Lakshmi, that I do get a lot of dislikes on COVID vaccine videos, and I do respect people's emotions and their own thinking about that. But in general, in addition to answering, are there any booster vaccine for improving immunity in children? Do you want to just say something so people can have confidence in this? So just to guide them as to what is the right thing to do.
Yeah, so I think we need to understand why we haven't really thought about COVID vaccine in children as yet, right? So children, adults taking vaccine is probably a new phenomena. children taking vaccine has been going on for several decades. So vaccination is something we have associated with children for quite long. Now, all parents know, I mean, you take vaccines for polio, you take vaccines for tetanus, you take vaccines for DPT. There are a lot of new vaccines that have come up for typhoid, for loose motions like rotavirus. Why is it we have a vaccine? We have a vaccine because we know that these diseases, like are killers. They are very lethal for children, and these are one of the reasons why children who are less than 1 year old and less than 5 year old, they used to lose life. And it's a remarkable achievement what we have done over several decades, conquering diseases like smallpox, like polio, purely through vaccination. And these diseases, many of them either left with significant problems later in life, or they were lethal. Now, question is COVID similar? So the problem is right now with whatever we have spoken, the COVID is not has been a mild infection until now. So that's the reason the focus has been on those people in whom it is a life-threatening illness. So people with comorbidities and who are elderly. So that's the reason vaccine has not been developed yet, because it was mild infection.
Mm-hmm.
Second point we need to understand is that how whatever complication we are seeing with COVID, it seems to be happening a month later. That has something to do with the immune response. The idea behind we give a vaccine is it's like to mimic a natural infection. So we take a part of virus, either killed or dead, and then you develop a immune response and antibodies, which protects you against from future infection. So you take a vaccine, it creates an antibody response. So in future, if you really catch an infection, now let's take an example of polio. So you give a polio, which is killed polio, into your body. Body recognizes this as a real polio. It produces antibodies. And tomorrow, if you get a real polio virus in your body is going to destroy that real polio virus, and you don't catch infection. That's how the vaccines work. But in COVID, what has happened is whatever complication, though unfrequent, is mainly because of post-COVID related problems like MISC or MISC. So that's to do with the immune response. Some of the antibodies produced seem to be attacking our own body cells. So what we really don't know is, are these vaccines going to decrease or increase MISC? Because it's to do with the immune response. Are we going to land up a situation where a disease itself was never severe and we vaccinated children and we have a lot of immune related problems later on? There were some concerns raised with the adolescents who received mRNA vaccine like Pfizer, with the heart becoming slightly weaker, but then it's not validated yet. So we don't have that information, how children are going to behave. So, however, having spoken to a few of the immunologists, they feel that a virus probably is going to decrease the chance of MISC. For all that to happen, we need to collect data. We need to see how the vaccine behaves. Is that going to decrease the chance of catching MISC? So these are the important points about why, before we think about vaccine. One thing we should know though is children have a very different immune response compared to adults. Their immune is still evolving, unlike an adult, which is established immune system. So when that's the case, we have to approach these things slightly differently compared to what we see with adults. And because their immune response is generally quite robust, they tend to defeat virus much more easily, especially the COVID virus. There is an thing called as interferon, which is a very important part in early infection to control viruses. That response is quite robust in young children, compared to elderly people, and might be that's the reason why children do tend to have usually asymptomatic infection. So to say the answer, there is no vaccine as of now. There are vaccines under trial. Booster dose is something we say where we've given a vaccine in the past, we repeat one more dose of vaccine to enhance, to ensure that the cells in the body have not forgotten the previous exposure. So the booster topic only comes after the first dose is given. As of now, there are no non-COVID vaccines. There was clear interest with the BCG vaccine. Some people said MMR vaccine. You give this vaccine, probably might boost up your immunity to fight COVID better. But unfortunately, none of the studies have shown that giving BCG or MMR, these vaccines might boost up our immunity to prevent COVID infection. Might be for Lakshmi, might have some other comments she could probably add.
Yeah, no, I think that was a great summary of where we are with current, vaccine development for children. And yeah, it is not yet available for children. But when it's available, I think that's going to be a really important mechanism to keep them safe. And again, the concept of boosters is only going to come after primary vaccinations are available. I'd like to make a related point that, during the COVID pandemic, one phenomenon we're observing in the US is that parents are worried to take their babies and children in for regular immunization. So one side effect we're seeing of the pandemic is children are missing regular immunizations. So I just want to also emphasize that it is still important to get our babies and children protected against regular childhood illnesses, all the other vaccines that you mentioned, Dr. Rakshay, the MMR, the polio vaccine, the DPT. It is still important for parents to make sure that their children are getting all of those vaccinations as well. So something we shouldn't forget when we get so focused on COVID, that there are other childhood illnesses that we still need to protect our children from.
Yeah, absolutely. Well said. I do see a question that says, is there any home remedy for COVID-19, assuming children?
Yeah. So, well, people have tried various things. We've heard people doing betadine gargles. We've seen people taking up steam. There are homemade kashayas with various mixtures people have tried, but I don't think any of those work. What we have seen of late, though, is a question a bit related to that. More than a home remedy, people want to know what diet to take to boost your immunity, and the effect of this is what you've seen in children of late over 1 year is an epidemic of obesity. People have been staying at home. Children have been staying at home. There are no physical activity. Parents have been sitting at home and been feeding children all along. And children who are supposed to get only 1 or 2 kilos a year are gaining like 10 to 12 kilos in a year. And one thing what is at least clear with adult experience is obesity is a risk factor for a severe COVID. So if you really want to protect yourself, and I think it's important to be on a balanced diet and keep ourselves physically active and ensure that we don't land up with a problem like obesity, which has far, far more implications for a young child becoming obese at a very younger age group.
Yeah, completely agree. And I think also to remember, a lot of infections in children are asymptomatic or mild. So you really don't need a lot of therapies. So, a lot of things that are being touted as home remedies, we don't really have evidence that they work one way or the other. And the truth is, probably for a lot of mild infections, you don't need anything other than just supportive care and management of fever and helping the child eat and drink something and just recover from the illness. So there's really not evidence that the home remedies are going to make that recovery happen faster. So there's just a lack of evidence around a lot of these things that are being touted as home remedies.
Yeah, great, thank you. So, bottom line is, I think people should continue using common sense and then do things, like continue a healthy diet, do physical activity, and just maintain their normal health, right? Taking adequate COVID precautions if appropriate. I do have a question that says, why are COVID-19 positive children showing more gastrointestinal symptoms this time? Is that true?
So, we should know how the virus enters the body, right? So there is something called as ACE2 receptors, and these receptors are present in our lungs. They are present in our GI system. They are present in the vascular endothelium as a blood vessel lining, and they're also present in kidneys and in the liver. So you can have a presentation which involves any of these systems. So the gastrointestinal system can get affected because the viruses can enter into our intestines directly because there are receptors, and they can present with the loose motions and vomiting. And it's not just in children. We've seen that presentation happening in adults too, but it is true that we see this presentation slightly more common in children compared to adults.
Okay. Should children be steaming? Meaning, I assume should be taking steam inhalation. And what about masks for children under 2?
So I can start with. Oh, sorry. Go ahead, Doctor. Go ahead.
Yeah, go ahead, Lakshmi, please.
Yeah, I was going to say the first thing, masks under age 2 are totally prohibited because one, the masks can be a suffocation hazard, right? Like they slip across and block the baby's breathing. So no, there is no recommendation for masking under age 2 or face shields under age 2. Really, the people around the children should be masked to prevent, to have source control and prevent transmission from the adults and other people around the children. So no masks under age 2, just because of the risk, suffocation and blocking of air entry. Steaming, there is no, as far as I know, there is no evidence that supports that steaming is beneficial. But again, I would like to hear what Dr. Rakshay has to say about that.
Yeah, like I just said in the previous question, I mean, we have seen people steaming repeatedly in a day with the idea of the heat is going to kill the virus, but I don't think that is supported by a strong evidence. And especially in children, you need to be even more careful with steaming because we've seen a lot of children, even before COVID, coming with incidences of burns on the face and the body with hot water spilling because the young children, it's not easy to hold. And so you need to be really, really careful before you try a therapy which can potentially cause a burn hazard.
Okay. So, bottom line, it sounds like there is no evidence for steam inhalation, but if someone is older enough to safely take steam inhalation, they could try it out, if they think it helps them, right?
Yeah, and I'd probably caution against sharing steaming devices because,
Okay.
again, it could be a reservoir, I suppose, for transmitting infection.
Okay, that's a good point. I want to be respectful of your time, so we might have some time to take maybe one more question, and then we will, sort of. So, can newborns get COVID-19? Dr. Lakshmi, I think you might have already touched this, but if you want to briefly say something. And the next question is, can balanced diet prevent COVID-19?
Yeah, I'll take the newborn question very briefly. And to summarize, the answer is yes, newborns could potentially get COVID, but the risk of transmission seems extremely low. It doesn't seem to happen during the pregnancy or even during the delivery. It seems to be after birth by transmission through aerosols and droplets from the adults to the newborns. But again, the risk is very low, and newborns typically don't get very sick from COVID unless they have other risk factors related to prematurity or other diagnoses or other medical conditions that the newborn has. So bottom line, very low risk. It's not impossible, but it seems like it's a fairly low risk for newborns to get COVID-19. And adults around them, if they have the infection, should mask, should distance, not distance, but should do hand hygiene. And if they're feeling ill, should try to maintain space from the baby.
Okay. Dr. Rakshay, anything you want to add?
Yeah, so I think I agree with Dr. Lakshmi. So there's also this constant question I keep hearing sometimes from parents, oh, we thought children never get COVID. So it's not true. Children do get COVID, but what we're saying is they don't become sick with COVID. So there's a difference between catching infection and becoming sick. The chance of them becoming sick, at least until now, is quite remote. It's not very common, but they do get infection, and majority of the time it tends to be asymptomatic. Now there was this question about balanced diet. I think what is see, people how do we prevent COVID and how do we actually land up having a better immune system? This is a common thing which people keep asking. And I think what is very important for us is, this pandemic has caused a lot of psychological damage to the entire community per se. Too much of despair, anxiety, fear of unknown, not knowing what is going to happen tomorrow. Now, this kind of negative atmosphere which is prevailing, it can actually decrease your immunity because the negative thoughts, negative emotions, anxiety, they produce hormones which can actually decrease our immunity. So that's very important for us to understand. So situation, there is there, none of us are denying it, but then I think maintaining a positive attitude and seeing things, having a confidence of going through this pandemic in a confident fashion, I think is extremely important. And what we're seeing is this anxiety percolates into children very easily. 3 days back, we had a child who came in middle of the night saying her saturation was 50%.
Oh.
She had a panic. She said she's breathless, and then when she came, it was just 100. It was 98%. Saturation is completely normal. She was just hyperventilating the entire night. There was this whole behavior of a family having undergone had a COVID infection a month back, and they've been constantly checking saturations morning and evening. And this whole behavior of the entire family, the anxiety, the fearfulness, watching the TVs, telling about how people are dying and how the black fungus is killing people. It's really creating tremendous amount of anxiety among people. So we need to know. I think we need to face this pandemic in a very positive fashion, in a brave fashion. If not, filling ourselves with anxiety that's going to decrease our immunity anyway, and we are going to predispose yourself to COVID. The question about balanced diet I made is, in the attempt to actually increase immunity, people are eating all kind of stuff. Children, many of them are working parents. Now they're staying at home for the first time. They're observing a child, so they just feel that the child is not feeding enough. They constantly feed a child. Creating obesity is a problem, and obesity is not just a risk for sick COVID. It significantly increases the chance of developing early onset diabetes, hypertension, all sorts of heart problems. So a balanced diet, irrespective of COVID, is extremely important for us to generate a healthy lifestyle, which itself is a good immunity booster.
Yeah. No, well said. Well, I think we are. We do have one more question. I don't know if you have time to take it. So, how many years does steroids have an impact in our body?
So the question is, how do we give steroids? How long do you give steroids? Those are very important things, right? So steroids can be given through nasally. For example, there are people who take steroids for nasal spray for asthma for years together without having significant side effects. You can take injection steroids and have significant complication. So it's about, to answer this question, steroids can have an effect which can stay for very long, but that depends upon what dose was given, which steroid was given, how long it was given, and how it was given. So it's a bit more complicated to answer.
Yeah.
But oftentimes, when we give steroids for a long time, we tend to taper them for a bit longer period of time. But generally, the kind of doses given, so steroid again, is a drug we give in COVID with moderate and severe disease, not for mild disease. It's not a protocol that you cross 7 weeks, you need to take steroids, which we are seeing quite often, unfortunately, in adults who are absolutely recovered from COVID but still take a dose of steroids. So it is given for a very specific indication, and the format which is given, generally, it's a life-saving drug. But yes, if it's given inappropriately in a fashion, it can have an effect which can stay for long. But generally, for the disease we give in COVID, it should not cause complication later in life.
Okay. Great. Thank you. So, Dr. Lakshmi, Dr. Rakshay, I know you're very, very busy. I want to thank you for taking out your time, for being here. I want to thank all the audience for watching this and then being so interactive, asking questions. I hope you found some value. Do like, share, and subscribe to the channel. So thank you, Dr. Lakshmi. Thank you, Dr. Rakshay. So,
Thank you.
Thank you so much. It was a fantastic webinar and had a very interactive session. So thank you so much for hosting this.
Yeah, thank you.
Yeah, thank you. Thank you so much, Dr. Raj, and thank you, Dr. Akshay, for participating, as well as Dr. Vijay, who's left. But this was great, and it's great to see all the questions that parents have. And I think just to echo what was said earlier, we will get to the other side of this pandemic. Let's stay hopeful, stay optimistic, and follow some of these common sense precautions, and we'll get there.
Excellent, Lakshmi. Absolutely.
Yeah. Thank you all so much.
Thank you.